Today's injury report brought to you by Cape Regional Health and Dr. Kevin McHale with Penn Orthopedics and Cape Regional Health System, the best of both worlds. For a healthier life, for an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. And Dr. Kevin McHale joins us now on the Boardwalk Honda Hotline with a look at a couple of injuries that we're going to dive into here. Doc, every week it seems to amaze me that there's things that come up, and you're thinking to yourself, man, how can there be so many various injuries that happen in the NFL? But it shows you how brutal that league could be. But, you know, I hear a bicep injury from Jason Peter, and I immediately feel he's got to be done for the year. Well, there's some reports out there that says he's going to try to play. How is it possible that an offensive lineman is going to intend to play with a torn bicep situation?
So it really just depends on what type of tear he has, all right? So there's the biceps muscle. We all know it's a muscle in the upper arm. Everyone's working out to look at the beach, but it has the two attachments. You know, the one, what we call the distal biceps attaches at the elbow, and the proximal biceps attaches up at the shoulder. So when you have a rupture of the distal biceps, if it's a complete rupture, typically those do need surgery. As you can imagine, if that thing's completely torn off the bone, you're going to lose a lot of strength to elbow flexion and forearm rotation. And as a result, they need to be surgically repaired, reattached to the bone, and given time to heal. And typically that is a season-ending surgery. The thing that's different about the elbow attachment of the biceps is that the two tendons of the biceps attach at that point and kind of form one tendon. At the shoulder, those tendons split apart, and there's two of them. There's one that goes up in the front of the shoulder, attaches to the top of the socket, and another one that attaches to a bony prominence closer to your chest. So when that tendon's ruptured, a proximal biceps rupture, the other tendon's still attached. And as a result, it actually doesn't affect overall strength all that much. So hopefully, for Jason Peters' sake, it's a proximal biceps rupture. If that's the case, you know, we've seen players like John Elway, who had that, and a couple weeks later was back to playing, played through the entire season, ended up winning a Super Bowl because there's a lot of times there's some degenerative tearing that's there to begin with, and then that acute traumatic event happens and it causes the rupture. It actually gets rid of pain that was there from all that degenerative tearing. So it's very different, very, very different injuries. So we'll have to wait and see what kind of reports come out based on the MRIs and when we get a little more information about what type of biceps injury we're dealing with.
All right, so let me ask you this. He's going to get an MRI. He told reporters after the game he was fine. The doctors say they're optimistic he'll be able to play through the injury. But do you lose strength? I mean, are you going to be less do you have less strength in that arm?
So a couple of things about that. Number one, Jason Peters also said he was fine after the MCL, ACL last year. So you can't always trust that. So, you know, we really have no idea at this point. But there's
can I ask you this question? Sure. Like, if that injury, if you had one of let me see if I can remember, proximal or distal, right? If you had one over the other on the time it occurred, would you feel differently at that? In other words, would one hurt more to where, oh my gosh, I got a distal bicep tear, I can't move my arm, or I have a proximal bicep tendon tear, my arm has a little bit less, more range of motion?
Yeah, they're drastically different, and we just don't have the information because we didn't get to examine them, right? So as a physician, it's pretty clear when you examine someone what end of the biceps was injured. So when it's torn at the elbow level, you can do special tests to look to see if the tendon's intact. Sometimes those tears at the elbow level aren't a complete rupture, which are fairly obvious to detect, and you can see the muscle kind of retract up. And when that happens, when it's a partial tear, they'll have pain at that tendon, but it's not completely torn off the bone. And as a result, that could be one of those injuries that could be potentially played through, maybe a short absence, rehab, to see if they can get it to heal and allow them to play through it with a brace, something like that. But even that's a little bit scary because those distal or that elbow end of the biceps can rupture or tear further and get a complete rupture, and then we're talking about that season-ending surgery again. At the shoulder level, the proximal biceps, completely different appearance. It does result in what we call Popeye deformity. If you remember the Popeye cartoons, they get this big muscle after they eat spinach. It's the same appearance. So it retracts down, and it looks like that. You know, it looks like this big ball of muscle in there, and these guys are already muscular to begin with, but it's pretty obvious. And it's a completely different, presentation to the physician that's looking at them. And there's no question that would affect function much, much less than a distal biceps, which results in profound, significant weakness with flexion and rotation, as opposed to that other one, which really doesn't have a huge effect on strength at all.
Now, If he had one over the other last night, would you have expected them to brace it or do? I mean, I saw him on the sideline after he was out of the game, fist pumping guys as if like, hey, everything's cool. I'm all right, guys.
Yeah, so I think that would point, so going off of that information kind of leads us to think maybe it was that proximal bicep center rupture because you don't really need anything for that. Sometimes people go in a sling for a very short period of time just to rest it, but you really don't need that. You're allowed to do range of motion as tolerated right away, and it's encouraged. You don't want them to get stiff, and it's not actually something that needs to be immobilized. If it was the elbow, sometimes they will put them in like an elbow brace. Particularly if it's a complete rupture, sometimes they will go in a sling. So it would, that information alone makes you kind of lean towards maybe it was the biceps tear at the shoulder level, which would be the ideal one. Definitely the one we're rooting for if you have to root for an injury, because versus the other option is much worse.
When we say that you'll be able to play, does this mean immediately, or even this, lesser of the bicep tears, you still need to miss some time?
So,
as opposed to the other one where you're out for the entire season.
Yeah, so a complete rupture, distal biceps tendon tear, he's out for the season, he's getting surgery. The partial tear of a distal, meaning at the elbow, that would require likely a couple of weeks out, and then hopefully get him to rehab and get back to play at some point. But that proximal biceps tendon tear, he may be back as soon as next week. He may need a week off to allow the pain and swelling to subside. But if you're asking, interviews with John Elway after he ruptured that tendon, he actually felt better because he had so much chronic pain in his shoulder from this partial tearing. Once it finally tore, he felt better. So the shoulder level tear, definitely one you're rooting for. May not miss any time at all. If he does miss some time, it might only be a week or so. But that elbow injury would be much more significant, and hopefully that's not the case.
Okay, real quick, because we didn't get a chance to talk about this one last week, and that was Ajayi, who tore his ACL and continued to play. I mean, I guess we've heard there's been cases of this, but he's a running back. I mean, have you heard how often does this happen? How does it happen? Where you see some of these guys, they tear the ACL, they're down. I mean, they look like they got shot. He continued to play the game. I mean, so does that talk to the significance or maybe the lack of significance of the injury?
That could be one reason, right? It could be because of a milder injury, but most of the time when you have these ACL tears, it's a complete tear and they all present the same. It's this acute pop, it's painful, and because there's blood vessels that are attached to that ligament, it bleeds right into the knee joint, gets really, really swollen immediately, very painful right away. And honestly, I think it's more of a reflection just how tough Ajayi is, that he was able to play through it.
With a broken back, mind you.
I know. This guy that's playing through with a broken back, and now the knee injury. So, I mean, it's incredibly impressive. Obviously, we saw Carson Wentz play a couple of plays with his ACL, LCL tear last year. I think Phillip Rivers did it in the past. He played a game. I think it was like an AFC championship game or something like that. But for a running back, it's almost, it's incredibly impressive because the ACL is incredibly important for rotational stability of your knee, which is, clearly important when you're doing cutting and pivoting motions that a running back needs to do. So it probably has to do with just he's a really, really tough guy. He toughed it out for the day. Unfortunately, it's a terrible injury. It's in his good knee. It's not the knee that he's been having trouble with for a long time. So now he has no good knee anymore, unfortunately, and it's just kind of devastating injury for the Eagles and for him as a player.
Yeah, and he took out an insurance policy on that knee in the event that something would happen to him, and unfortunately something did happen. But what a tough guy to play with a broken back and a torn ACL out for the year. But great stuff, Doc, on Jason Peters. And, we'll check back in probably on Thursday on him to see if we get any updates with which he has. But it sounds like from your background that it looks like he might have the distal bicep tear, which means he might be able to go on, next Sunday. He'll have 10 days to get ready for his next game, so we'll see if he's ready to play. And, of course, our injury report today brought to you by Cape Regional Health System and Dr. Kevin McHale with Penn Orthopedics and Cape Regional Health System. The best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Doc, have a great weekend.
All right, great. Thanks for having me on. Always fun after a big win over a division rival.
That's right.
Good day to come on.